Hi, Stephanie Eubank here with RE/MAX Professionals and the Princess and the Hippie real estate team. Today, we're going to talk with Dr. Darren Chugg of Arrowhead Family Dentistry and learn all about his practice.
Dr. Chugg, just tell us a little bit about Arrowhead Family Dentistry.
Well, Arrowhead Family Dentistry is a general dentistry practice, and one of the things that we like to emphasize in are three basic concepts. Is one, we want to be as friendly as possible, because I don't think anybody wants to do dental work and not have a friendly face. The second thing is we want it to be affordable. Access to care in the United States is sometimes a difficult thing, and something I want to do is make access to dentistry possible for people. The last thing is quality. Just because it's affordable and because we're friendly doesn't mean that we can't make it a quality product as well. So those are three things that I really take pride in, and that I really want this practice to show to my patients. It is a newer practice, and I think a lot of people think that because of the name, it says Arrowhead Family Dental and Dentures, that people assume that we only see older people because of the name dentures. However, it is a family practice, so we like to include all people, all ages, starting from the first tooth all the way to the last tooth, depending on when that last tooth is.
Yeah.
Hopefully we keep the last tooth throughout our lives.
So tell us, how did you get into dentistry?
Right out of college, I actually went to pharmacy school, and I was a pharmacist. I really enjoyed it. I enjoyed the people aspect of it. But about 4 or 5 years into it, I just began to get really restless. I felt like I could do more for my patients. I felt like I could do more for myself as well. And so I had some neighbors. One was an engineer before he was a dentist. The other one was an engineer before he was an orthodontist. So they kind of went back to school later in life, so I was like, I can do that.
Yeah.
And my father-in-law, he's also a dentist. And so I had all these dentists around me, and while I was actually going to pharmacy school, I kind of had it in the back of my head. It's like, that might be a good idea to do. And so one day I just decided to jump into it and start shadowing and just to see if I would like it. And the more I got into it, I saw how complex it was and how interesting it was, the more I wanted to do it. So, and then from there, I just took the right steps and went to dental school, and here I am.
Yeah. So a lot of people, present company included, don't like going to the dentist. So what are some things you guys do to help patients feel more comfortable?
Well, we do offer certain types of sedation. In the future, hopefully, we'll offer a few more options for sedation. So that's one thing that we can do. But I think even more importantly than that is the build up to the treatment, and it's just explaining what's going on, what's happening now, what's going to happen, and what to expect afterwards. And I think if you have that education and that understanding of the whole process, that it just alleviates people's fears of the unexpected. Exciting things, well, there's always exciting things that happen in dental practice. Everybody knows that.
Absolutely.
Hopefully no screams. But we always have monthly specials. This next month we have a teeth whitening, in-office teeth whitening special. It's $99. It's kind of nice because you come in, you sit for about 30 minutes with a little blue light on your face, and then you go home with a pen, and so you can kind of touch it up as you go.
Oh.
And then after several months, if you still want to go